Let's talk about breast reconstruction in women who are living in larger bodies or who want larger breasts. So I can't give you specific medical advice for you, so we're just going to talk in general about breast reconstruction. So there is somewhat limitation on the amount of volume that we can give you in that initial surgery for two reasons. So the first thing to consider is that implants in the United States have a limited size range. So as you mentioned in your comment, about 800 cc's is what we've typically told patients is the largest implant on the market. But there is now an implant company, Mentor, who has an extended size range that was specifically designed for reconstructive patients. And so I believe it goes up to 1445, so significantly larger than that 800 cc's. So that might be an option for you. So sometimes even with these larger implants, or you might be at a hospital that doesn't have access to this extended range from Mentor, we can add additional volume to the implant with fat grafting. So I've had lots of patients with amazing results with fat grafting after implant placement, and you can do this several times. So if you're a patient where that 800 cc implant is really the largest you have available to you, fat grafting can add 150 plus cc's each time to your breast reconstruction and allow you to get volume closer to what you want. Now, another option is doing a hybrid procedure where you do a flap and an implant. And so that's an option for patients as well. So this can be done with a free flap as well as an implant, or you can also have a pedicled flap like a latissimus with an implant. So I always think it's helpful if you're a patient going through breast reconstruction, you have a concern that the volume you want is not going to be able to be achieved by the chosen method of breast reconstruction, to have some kind of 3D imaging done, which will give you a volume estimation of what you are starting with. And if that's what our goal is, then your surgeon should be able to discuss with you how we can achieve your goal. So it might not be just an implant. You might need fat grafting or a flap. So it's an important conversation to have before surgery so that your expectations are met.